Our division has a long list of accomplishments over its 50-year existence. I think chief among those accomplishments is our fellowship training program. My name is Sari Akra. I'm the Division Chief of Pediatric Gastroenterology, Hepatology, and Nutrition at Vanderbilt. The intellectual environment here is very rich. One of the things that attracted me here many years ago, and it still holds true, is that there are so many smarter people than I am.
My name is Kelly Thompson. I serve as the medical director for our division. Our program is a busy program. This is a high volume center, so we see a lot of patients and you work really hard, but you learn a lot. We have about 20,000 outpatient visits a year and we perform roughly 3,000 endoscopy procedures a year. So our fellows have a really strong exposure to procedures.
My name is Michael Dole. I'm an assistant professor of pediatrics and I'm the associate fellowship director. So I'm actually a proud graduate of the fellowship program. I think one of the major positives of the program is how much fellow-driven it is. We take feedback from the fellows and work to continually improve all experiences from clinical, research, and educational experiences for the fellows. One of the programs that we were able to develop as I was finishing fellowship and that we've been able to continue is our fellowship boot camp. That is a period during the first week where our third-year fellows and support from the faculty help the first years on board.
This is really an environment that supports autonomy. It's also an institution where we really value interprofessional collaboration, so there's always a big emphasis on teamwork here. We have clinicians on staff who have expertise in a variety of pediatric gastroenterology disorders that fellows have the opportunity to learn about.
My name is Diana Riera, and I am the director of the Pediatric Inflammatory Bowel Disease Clinic. We take care of kids that have inflammatory bowel diseases, and we also do second opinion visits. At the same time, we're also part of the Improved Care Now network. We follow over 500 patients that have inflammatory bowel disease. And so one of the things that our fellows would be exposed to is when they rotate through one of our specialty clinics, they will be able to see the patients alongside myself or one of the other IBD physicians, and they get to experience the whole gamut of what it's like to present with inflammatory bowel disease, get therapy, and see a lot of the different processes that sometimes affect them at the beginning improve over time.
I'm Kirk Thame. I'm an associate professor at Vanderbilt, and I am involved in the motility program with a special interest in defecation problems, so constipation and encopresis. People start fellowship with a liking to one thing or the next, or having no real idea or preference for a subspecialty within gastroenterology. And I think the fellowship program gives you the opportunity to kind of explore that and find what your niche or what your special interest is. And so having a motility service gives you that experience and helps you with that to define what you really like.
My favorite part about being a fellow here at Vanderbilt is the perfect balance between clinical time and research time. They can tailor each fellow's interest and plan and really make it an individualized track. So if you're interested in basic science or clinical research, they will create the perfect mentor team to support you with your interests.
I really love the fact that at Vanderbilt, you come in and you say, these are the things I'm passionate about, and then everyone rallies around you and really just push you to do those things. So I think the world is limitless when you think about being here, because you pick what you like, and there's someone that's doing it and doing it well, that they're gonna connect you with that person so that you can become the best at what you want to do.
My name is Beth Nicholson. I'm an assistant professor of pediatrics and pediatric GI here at Vanderbilt. I do clinical and translational research, and I study C. diff infections, which can cause significant diarrhea in children. And I also study the intestinal microbiome and the role of that in pediatric diarrheal diseases. I like to help the fellows in terms of identifying research projects during their time here. One of the really nice things about Vanderbilt as an institution is there's significant collaboration both between divisions here in the Children's Hospital, but also through other schools in both the medical center and the university. It's one of the biggest benefits of having our medical center on the same campus of Vanderbilt University is team science is a real important priority here at Vanderbilt, and we can see that in the fellows projects that they're able to complete.
I chose Vanderbilt because I felt like there is a big emphasis on curiosity. I've been able to pursue a research project in both global health and nutrition, which is kind of marrying my two interests.
I'm really interested in functional GI disorders because a lot of times with them, we've done all the tests and that really just says from an anatomical perspective, from a pathological perspective, there's no disease that we see. And so we have to become more creative or understand other things that play a role, such as the brain-gut axis and the way that people manifest these abdominal pains or nausea or just things within the functional GI realm.
And it's really a great environment to learn how to take excellent care of kids and to learn how to practice medicine, but also how to be a member of a successful team and a leader on that team.
Everyone literally wants to see you do well, right? So you get to work with all of these amazing individuals that know they're amazing, know that everyone in the world thinks they're amazing, but they understand the importance of passing that knowledge on.
You know, to me, that is the kind of largest source of pride, is that seeing somebody that has been able to follow their passion and that we've been able to help them move along that path.